All right, guys. Hello and welcome. Today we are going to answer the question, what is precision medicine? I am Rachel and I'm a second-year PharmD student, and I hope you stick around and enjoy this presentation. Precision medicine, also known as personalized medicine, is not a new concept. However, it was officially introduced in the 2015 State of Union by previous President Barack Obama. And they define it as an emerging approach for disease treatment and prevention that takes into account individual variability in genes, environment, and lifestyle for each person. And we'll focus mostly on the genomic aspect today. Shown here above is PMI's mission statement, and I'll allow you to read that on your own, but essentially we're looking at a patient from all the aspects that make them unique. Question is, do we need precision medicine? Well, I want you to think about these 2 points. Sometimes drugs don't work, and we see variability in efficacy across patient populations. Secondly, to be blunt, drugs often do bad things, or more specifically, adverse drug reactions. And as we know, adverse drug reactions are events aside from what we expect therapeutically and are also shockingly the 4th leading cause of death in the US. They're a big problem. So how do these ADRs manifest? Well, without getting into the weeds, it starts once you take a drug, and it disintegrates and dissolves and travels through your GI tract, assuming it's oral. Now, eventually the drug reaches the liver, which is also the site where metabolism can occur. And the enzymes responsible for these are what we call CYP enzymes. Now, there are many types of CYP enzymes. However, the major players in drug metabolism are 3A, 2D6, and 2Cs. Of these 3 major CYP families, we do see polymorphisms occur, aka genetic variation. However, there is much higher prevalence within the 2D6s. Therefore, for many drugs that are metabolized by the liver, and specifically 2D6 enzymes, we see variability across patients, meaning our genes dictate the expression of these enzymes, and therefore our PK and PD profile, which may be different, and therefore the effect we see from the drug may vary. And that's where it makes a difference as to whether the drug works or doesn't work, or if the drug causes adverse events or not. So when it comes to drugs impacted by these pharmacogenomic differences in metabolism, it's impossible to predict an outcome without knowing one's genotype. And that's where precision medicine comes into play, because we are looking at the whole patient, differences in all, to improve therapeutic outcome. Whoa, so let's back up a little. So precision medicine enables us to predict drug action and determine if the drug will basically reach that therapeutic index to have effect, or on the flip side, maybe not work as well due to overactive metabolism. Then we can predict the effect similar to drug action, but more focused on the pharmacodynamic profile, therefore whether the drug has a therapeutic versus adverse effect on that patient. And finally, and we didn't explicitly touch upon this, but we can use this pharmacogenomic data to predict appropriate therapy through these biomarkers and gene profile, etc. And we see this a lot in the oncology field so far, and there are more research areas to come. Okay, so we made it. So where do we see precision medicine in action today? Well, it's not utilized as frequently in the clinical setting yet. However, there's still plenty of research happening in this field. And the beautiful thing about precision medicine is that it really applies to so many different fields in science and healthcare. I've just listed a few, but precision medicine's place is still growing, and much of the research available shows positive outcomes from utilizing this info in practice. Therefore, as future clinicians, I think it's important to be aware that this data is something that is important, relevant, and quite possibly going to be implemented in your practice in the near future. So thank you for listening, and I hope this provided you with a quick snapshot of what precision medicine is all about.